in the mail Friday, so, if you want a quick, made a copy of the minutes from last meeting, if you wanna quickly go over those, and if there's no amendments or, corrections, can I get an approval?
So moved.
I second.
All those in favor?
Aye.
All right, we'll start with old business, from the clinic.
Starting with vaccines, so averaging about 20 shots a week. I just ran a report this morning. Since January of this year, we've given 176 people shots. And individual shots, 395. So, ran that this morning with communicable disease. I had 6 new epi cases compared to last meeting that I've been following with. I'm still following one of our LTBI cases. Moving on to lead for old business. Just following up with all of those cases. I've got a lot of confirmatory I'm waiting on. I've got some new cases. Just waiting on follow-ups. Big one on the old business is our pet grant. So last time we talked, I believed I was caught up on our requirements for pet grant. They got a new regional pet grant coordinator in, and we reviewed all of our requirements. And we have to redo some of them because previously, in the first 2 quarters, the primary and the secondary were Jessica and Holly. So now they need to have a new primary and secondary. I'm primary, not sure on the secondary, they need secondary. To go along with that, the secondary needs 4 FEMA training modules completed and turned into state. That's another issue, not just because we don't have secondary, but because the FEMA site is down and the modules can't be completed. One of the requirements is to submit a survey that lists all of our struggles and barriers to completing deliverables. Those 2 things were on the last requirement due in March that I put in there. We didn't have a secondary, don't have access to FEMA, and staffing changes in general. So otherwise, most of the other requirements, she said that we can, so long as we get them done by the end of June, the state will be happy. So that's kind of where we're sitting on PEP grant wise. We're still getting our invoices in, making payments on the things we need to make payments. I think that's it for PEP grant for now. Working on completed projects, we did purchase, receive, and deliver that hearing screener we talked about last meeting. We delivered that to the community health clinic. They're out of Shipshewana, but they use this hearing screener, infant hearing screener, just for Adams County residents when they do their mobile clinics down in Burton. They've already used it once. They absolutely love it. They said it worked very well with it, their infant they screened. I don't have any more numbers other than they've used it once. We also had that same day that they had used it, the Coffee and Compassion event at the Burn Senior Center, where we opened up to the community. It was for anybody. Had a lot of Amish families come out for resources. I had resources on the public health clinic on the table. We also had WIC come and talk, and Brightpoint, I believe 2 other resources available. And that went very well. I think that's all old business.
Any time frame on how long the FEMA site's gonna be down?
I was told it was tied to the government shutdown. Like
Okay.
Once they fund it, it should come back up.
Okay.
We'll move on to the environmental update on Swiss Meadow. Oh, go ahead.
I'm sorry, just really quick, because we're live streaming, I think that we need to have everybody to talk, go up to the table, because they can't hear us back here, if that's okay. Sorry, Sarah just messaged me and asked. I know, I'm sorry.
Like
Hi.
Here you go.
Oh,
Figure out how
First, you gotta
to turn
sing a solo.
good morning.
Hear that? First, you have to
It's not
sing,
even on, thank God for that.
first you have to sing a solo.
I'm not very good at that. It's a good. There we go. Okay, so for the Swiss Meadows update, I mean, basically it's good news. So they ended up selling, so we've got new owners of it. The Bradley Company is the management company that's gonna be in charge there, overseeing all of the operations and maintenance. I talked to the owners, the lady, she called me herself, a couple weeks ago and basically said that they were made aware that we still had an abatement on the place, just for the smaller things that we still wanted to be cleaned up that weren't done before the sale went through. There's one building in particular that we had an infant fatality at, and then that's kind of been over taken with cockroaches. So we have the placard on the whole building right now until that was abated, but we kind of just wanted the sale to go through. So we weren't really pushing anything with the previous owners, but the new owners are on site and taking care of all of the issues that Shannon, Mark, and I had found in previous walkthroughs. They seem to be really driven owners, so we're looking forward to that, and hopefully we start seeing a turnaround there. So.
Do they have a timeline? Have we put a timeline on them?
We have not at this point.
We really didn't, because we were wondering, you know, ourselves when the sale was actually gonna go through, because there had been a pushback. And then the new owners found out about our abatement, and then they pushed it back another day, and then they ended up going through with it. So right now we're just confident that they're working on things, and we're gonna keep checking in with them.
Are we involved, is the health department involved with, Country Acres?
We no longer have any involvement in that as far as enforcement goes. Besides, it is, all the properties out there are still declared unfit because of the tank out there.
Yeah, and
then, yeah,
I can't, Clayton Langrick,
right.
he has been totally on top of
Yes.
working through the legalities. I don't know exactly where it is, but
Yeah.
we're moving.
Yeah, so I know that they sent out all of the homeowners of their own abatement letters just because of the trash and stuff.
I figure I'll come up by the microphone.
Yes,
here.
there you go.
So,
Okay.
I did meet with Mark Burry and with Clayton, I don't know, a month ago, something like that. And talked about maybe some potential options that we might have moving forward to try to get sort of whatever's left, the leftover issues out of Country Acres resolved. And I think we came up with some kind of plan, but it's not something the health department
Okay.
is gonna have the jurisdiction over. It's
Right.
something
Okay,
that-
super. I'm glad to know that.
Yeah, so it's something that, and I couldn't even tell you without looking at my notes what the resolution we had kind of came to, or the ideas we had, but I know it was outside of our jurisdiction with the health
Okay.
department,
Well,
so.
Clayton has been very good about giving us an update of what,
Yeah,
the legalities of what he's doing. So
sure.
super. Appreciate that, Lou.
Yep.
Does anyone else have anything for old business?
Just one thing.
Yep.
And Joe, back, I was just looking through the, February 4 meeting notes. And it said the health department door upgrade was denied due to this building being considered for renovation. Well, that's all changed. So are you still looking at having more security up there?
I've got some ideas on that entranceway, so I'd like to hold on that
Okay,
until we can have a conversation.
super. Okay.
But yeah,
Okay,
since we're not moving, I'm looking at a couple of ideas.
Okay, well, when you're ready, let us know.
Okay. All right.
Thank you.
Yeah.
That's all I have.
Anyone, anything else, old business? Okay, we'll move on to new business for the clinic.
I'll start with the communicable disease. I don't know if you've seen in the news with those bird farms in the south end of the county. We will be involved eventually in following up with that for the health side of it. So the Board of Animal Health, they have to go out, they have to quarantine and do depopulation and composting of those farms.
No, okay, I don't want to interfere.
Yes, sir.
Is this a previous occurrence or is this current?
This is current.
Wow.
I saw it in the news a couple weeks ago. It was, I think Sadie sent me the news article on the Saturday, and I got the call on Monday that I would have to follow up.
Southern Adams County.
Yes, sir.
large duck farm.
Yeah.
Thousands of ducks had to be put down and.
Wow, okay, I didn't hear about that one.
Mhm.
Okay, wow.
Yes, sir. So as soon as the Board of Animal Health tells me who I need to call, what I need to follow up on, I'll be following up with that. Offering testing and what we call PEP treatment. So medication if people need it or want it. But that'll be up to the Board of Animal Health.
And that's Maple Leaf, is that correct?
I'm sorry?
Maple Leaf, is that the firm? Is that the organization? I don't want the name of the producer, but the firm they're working for, is that Maple Leaf probably?
I am not sure.
Okay.
I wasn't told that part. That's one thing that I will be following up on that's new. There is a large contact investigation. I'm not sure what all I can say yet for a communicable disease. It does span multiple counties, and at this point, it's just contact. So when I know more and what I can share with that one, I'm just letting you know. And then I've also started up taking on the animal bite cases that Stacy had been following up for us. I believe we've had 11 cases since we've last gotten together. And that one definitely, animal bites should definitely stay with the nursing side of it. Moving on to new business with our HFI, the Health First Indiana funding. I've been looking through all of that to do our carryover request to afford that hearing screener. I was looking more into our funding, and we will probably send in another 2026 budget, because you can resend a budget for the current year. If things change, if you need to reallocate money, especially if that's more beneficial than a carryover request, you can do either or. Because I know with all of our changes, we're finding what we need more of, what we need to pay for. And some things aren't quite where we need it, so we've been trying to look at that budget again. The finance report for 2025 will be due beginning of June. And then the new budget needs to be submitted for 2027, beginning of June as well. I'm not sure how much we've been awarded at this point for 2027. I just know when it's due for the next budget. And then finally, with our upcoming projects, April 18th, we will have a resource carnival in Monroe. Or we won't be hosting it, but we will be there. We'll be giving out tickets. We've ordered tickets to give that out, to give out there. And then we have another project. There's going to be an Amish event in May during the produce auction. We have not hammered down the 2 dates, but it'll be a 2-day event, Tuesday or Thursday.
Could you be a little bit more specific about the events themselves?
With the resource carnival and the Amish.
The Amish.
Okay, with that one, like I said, it's during the produce auction. We've been trying to get a theme going. We're gonna kind of theme it around water safety. So we've talked about lead in your water pipes, safe bath temperatures to give, your child a bath, because we've had a lot of scalds in the past. We've talked about getting, I believe Chris Burkhart has been very involved and offered to do some of the education, CPR. I have to remember what all the paper said, but I know that they're gonna be doing some education, including CPR. We'll all have booths. I'm hoping to get some baby bath thermometers ordered, that we can give those away, so that we can give those to moms. That way they can check their temperature before they put their babies in the bath, try and prevent some of those scalds. And I've been looking more at the mercury thermometers, just so that, you know, with the Amish, they're not gonna use the electronic, the battery, the rechargeable ones. That, and it is a little more cost effective, longevity, so. That's kind of the plans we've got in place right now.
Okay, could I just bring up a concern that I've had a little bit? And I don't know how it pertains to the health department, but in the Amish community, it's not uncommon that they'll have a small ice house.
Okay.
Okay, insulated ice house, so that they'll have ice for most of the summer. The concern I guess I have is they get their ice when the temperature is cold enough to freeze farm ponds.
Mhm.
And they take a chainsaw out and cut the blocks of ice with a chainsaw, and they put it in their ice house.
Mhm.
And I've often wondered about the bird droppings and everything else that are in those ponds and the E. coli that could somehow, you know, I'm not saying we need to take action on that. I'm just bringing it up to make sure that they're at least educated to the point that they know the risk that they're taking.
I have not touched on anything like that. I've discussed ice collection with some of the moms,
Okay.
but
Well,
beyond
it may
that.
not be in our arena. I don't know.
Mhm.
I believe it's nothing we regulate.
Right, okay.
Anyone have any other questions for Megan regarding the clinic? All right, thank you. We'll move on to the new business for environmental.
Okay, so we've got a lot of changes. Not only the food code changed at the beginning of the year, but now they're gonna throw food trucks and home-based vendor changes at us as well for the upcoming year. As far as food trucks go right now, they are regulated county by county, so they're responsible for getting a permit. If they're gonna set up their truck in Adams County, they need to come and see us and get in a truck inspection and get a permit through us. If they're gonna go to another county, they have to do the same thing there. They're changing this next year to a statewide permit. So basically our trucks have to establish their home county, and their new permit fee is gonna be $450. $250 of that is gonna go to the state. So we're really new to everything. We're not quite sure what exactly the guidelines are gonna be. If things happen in other counties that there is not their home county, we're really not quite sure who's gonna be responsible for regulating that. There's just a lot of unclear answers right now. As far as the guidelines and things like that go. I know it's been said that they will not be able to travel more than 60 miles from their commissary, which is the place where they prep their food and they keep their supplies and stuff like that. So it's definitely going to bog down on our food truck that we have coming in the county, and definitely the money situation that we have coming in too. So kind of been talking to the food trucks as they do come in, kind of encouraging them to choose Adams County to be their home base, just because we want to keep those trucks here and we want to keep those funds coming in. We'll know more about all of that. We should know more about it by July-ish, I would say. The home-based vendors are basically our vendors that do the farm stands and the farmers markets, and they do all the baked goods and stuff like that. There are regulations with that where they can't do TCS foods such as cheesecakes and cream cheese frostings and things like that now. All of that rule is going to be changing, and basically everybody's going to be able to make whatever they want from their homes and sell it wherever they want. So, we're not quite sure how that's gonna be regulated either. Because basically somebody could be selling burgers off their front porch and we're saying that once the rule changes, it's probably gonna take something serious like a child dying or something like that to get the rule reversed, unfortunately. So not anything good for our state right now that they're passing, and I just don't think that they're thinking about you know, the proper handling and different things like that with this changing this rule.
Who,
So
what agency is making these changes?
it's gotta, it passes through our whole government system, and
Came
right
out of our
now,
legislature.
yeah, right now it passed legislation.
Someone authored a bill,
Yep.
and that's what we're dealing with. So
Seems to me that's a step backward, not forward.
Oh, absolutely.
for us in the field, yeah, that's a huge step backwards.
So, yeah, and that's basically, I mean, now we're gonna have restaurants that are gonna say, well, why do I have to pay for a permit if Joe's over there making burgers off his front porch and selling burgers and fries just right there off his front porch?
Well, is that something that we ought to talk with Matt Lehman and Travis Holman about?
Absolutely. but
Absolutely.
I think it's past there, well,
You know what bill that was tacked on to? It's probably tacked on to something.
No, it was in its own bill.
It's yeah.
We can get that.
It's
You
the
have a
home-based
number for
vendor.
that?
We can get it for you.
Yeah.
Pardon me?
I can get it for you.
Okay.
Especially now with an election coming up.
Yep.
So listen,
So yeah,
Should have had it last night. Travis was at the Meet the Canvas night, and so was Matt. If I'd have known that, I'd have brought it up.
yeah, it's definitely not anything good, for, the food going forward, so.
there's no way we can override that.
I mean, we haven't seen really the official, guidelines or anything like that, so we're not quite sure what the details and things are gonna be in that, but I'm
You
sure,
have jurisdiction.
I'm sure there's
in
gotta
that.
be some type of regulation over, but right now we can't go in home-based vendors' houses or anything because, no, we can't. So I just don't know how things are gonna change with them being able to have a lot bigger realm of things to do. Yep, the 1424 House bill.
House Bill 1424.
1424, House Enrolled Act 1424.
Yeah.
Okay, now, Joe, you'd know this. You've been around the barn many times. Okay, what agency at the state level is in control of the health department? There's gotta be a state health department or something.
There is a State Department of Health.
Okay, didn't they counteract this at all?
As a former state employee, I can attest that we are not often asked our opinion on legislation. And most state agencies are not allowed to offer an opinion on pending legislation. We have to leave that up to the counties, the
Open public
open
comments.
public comment for that. We, in my old State Department of Health hat, we couldn't take a public stance on a pending bill. We've seen, septic bills in the past that just made us cringe. We're dealing with one now, but, it's just,
It is what it is.
it is what it is.
Hey,
You
I-
know,
I can get you a copy of it. Pardon me?
Was this a fast pass, like it was put in, the bill was submitted, nobody really talked about it, and then passed right away, like the septic?
Sounds like a
No,
separate bill.
no.
So this was,
1424 had a life of its own. It
Well, it's another good example. I've always said the county government is a headless organization because no one's in charge. And if you take it up to the state level, it's about the same thing.
I can forward copies of the 1424.
Okay, well, I'll definitely give, and I encourage everyone else to challenge our legislators.
Absolutely.
Otherwise, they got a lot of fires burning. And if the local people don't challenge, life goes on, right, Joe?
Yes, it does.
Thank you. Hey, just another one while you're here, Joe. You're probably up for comments anyhow, but back to the ice thing. Could you possibly check with LaGrange County, they have a large population and probably doing the same thing. Could you check with them to see if there's, since it's not under our jurisdiction, could it or should it be? You know, and see if they have anything.
Yeah, we can put it out there.
Okay, it's not my choice, it's the board's.
There's a large food group that we could ask.
Okay,
And I know context of
Yeah.
the arrangement.
well, I hate to see this flare up after some young child comes down with Mark, whatever.
And you think they're putting ice in the drinks, they're just using it to keep.
Who
it
knows?
cold?
The blocks that I've always ever seen with the Amish grocery stores are, they're stored to keep their refrigeration
Yeah,
cold,
that's
but
what-
I don't know what all, I don't go in their houses to see what else they
Your
do.
guess is as good as mine.
Yeah. So, okay, so moving on with vector control, we're kind of getting ready to gear up for the next season ahead of us. We kind of got to just keep going forward and looking ahead, but I attended the Vector Control Conference, which is a yearly conference a couple weeks ago. There was just lots of training and updates from the state, very good information that we get. I've also been working with Matt Schultz with the street department and Chase with Burn in Geneva on the chemicals that we're going to be using for the next season. I know that it was kind of brought to your attention last year that the health department's been the one funding the chemical for quite some time now for the whole county. And being in my second year, really taking full, handle on the vector and the chemical and stuff like that. And it's Matt's first year since Jeremy Gilbert left. We're just trying to figure out where we are as far as we're getting a hold of our inventory, wanting to really keep track going forward every year about how much we're using. I know that we purchased 10 gallons for Decatur last year and we used all 10 gallons. And there might have even been some still sitting there that we used up too. We're just not really quite sure about how much inventory we had been sitting on for the last few years. So we're really just trying to get a hold of keeping track going forward on what we're ordering and how much we're going through. I know that, our West Nile cases and the mosquitoes were the worst that they've been since 2012 last year. So if we have another year like last year, we're going to be spraying.
And remember, I used to do that when I worked for the town of Monroeville, and last year was an extremely low mosquito year as far as dry, breeding.
Oh, yeah. Oh,
So-
they were, the West Nile cases
But the
were.
West Nile, I
Oh,
know
yeah.
they were still there, but you plan to be using, we're bound to have more moisture than last year, I'd hope.
Right.
So
Yeah, so we use this, the spray, what we use is called Duet in all of our mosquito sprayers. And we've been working with Clark, trying to get numbers and trying to just buy it up early. It's gonna sound crazy. They have a 30-gallon drum that is $8,300. But if you think that we went through 10 gallons of it last year, buying at 2.5 gallons at a time, we'd be really saving a lot of money buying a 30-gallon drum, preparing us, for the next years to come and saving quite a bit of money on that. Working with Matt also to see if, and he's working with his board to see if maybe for the first time ever, if we can kind of collaborate with the funding, and see if the street department's willing to help us out this year, especially buying in bulk like that. So we're just waiting to hear back and see what they're willing to do and see if maybe we can get the costs from the health department down a little bit and where we're kind of, evening things out a little bit more.
Are you
Um,
talking
Know
about
what the
teaming up
shelf
with?
life is and that stuff.
Yes, and we would be okay. We're working with Clark and that 30-gallon drum would be okay for a few years.
If not, you might be able to work something out with Wells or something too.
Yeah.
Buy bulk and
Yeah.
split it up.
Yeah.
Oh, yeah. Oh, we'll use it. And
Okay.
plus just sitting in Decatur, that, we, with us also buying the chemical for Burn in Geneva as well, that could be split up. So,
Okay.
so absolutely. But we're just trying to get, some of the costs alleviated from us. Also, Joe and I met with Hayden down at IT, and we've created our own mosquito layer with the health department GIS. So I'm gonna be able to track exactly where I'm trapping and collecting at, when I'm trapping and collecting at certain places, and then if we got positives in that area. So, it's gonna be a lot better system for tracking, than we've had in the past, and we're really looking forward to that and getting on board with that and up and running. So yeah, basically the way Matt and I are gonna do things is the way Jeremy and I did, and they've done it in previous years, is that when we get positives, that's where he's gonna know to go and spray. Last year it got so bad that, we were kind of spraying half the town one night and half the town the other night. So hopefully we don't have as many West Nile cases as we did last year, but, we're prepared for that and working together very well.
Who calls the shot if spraying is needed? City or? health
It,
department?
it would be us, and we do, because I'll collect and then I'll sort the mosquitoes and send them into the state. And then Lee Green, our state entomologist, he'll send me whether or not they're positives or not. So, and I've also been learning, how to identify mosquitoes myself, so I'm getting pretty good at it. I got a microscope and I'm pretty good at it, so I kind of can wing out the ones that we really don't need to be testing for. And so we're setting in positive, good pools for them to test. Cool. Oh,
Placards for,
one more.
yep.
So for the placards, we have 8 unfit homes right now, not including, obviously all of Country Acres and all of the units at Swiss Meadows. But I've updated all the placards, so they're looking all nice and bright and, ready to go for this year, in case anybody needs to see them updated, so. But that's all I got with that.
All right. Thank you. Fee schedule is next on the list. I need to meet with Luke yet. He's been on vacation. I've been new to the office, so we haven't had much chance to get together. But to talk about proposed fees, I've got a few that I'd like to possibly ask for an increase in fees. I don't have anything solid yet, so I'd like to table that until we have a chance to meet and talk and then come back to the board with a little more firm schedule of fees for the department. Updates for me, if you've not met me before, I'm Joe Riccozzi. I'm your new environmental director. I came from 10 years at the State Department of Health, where I was a field staffer, staffed Adams County here in the residential on-site, the sewage program. Prior to that, I was 3.5 years at Huntington County as the sanitarian and the director administrator down there. So I've got local health department background experience. So I gotta say, you have an exceptional staff here at Adams County. Tara's doing a fantastic job on vector control for just really tackling her first year at it. I'm very impressed with the efforts we're making in vector control. But the staff that's there every day as a whole is working very hard, because if you're not familiar, you're not aware, Stacy's been out on FMLA, Sadie has been out on FMLA, Kristen, our clinic coordinator, office manager, her last day is tomorrow. Teresa has been on vacation part of last week and all of this week. And so everybody has stepped up very well and is doing a fantastic job. Nursing me along the way as I'm learning the local things, but I can't speak more for the staff itself. You have an excellent staff. Further updates for me. Besides all of our food and mobile rules, we have a new on-site rule, septic rule, that's scheduled to take place July 1st of this year, right in the middle of the construction season. We're right in the middle of the public comment period now. Overall, I think it's a good update. It's several years in the making. So as we get closer to that adoption, and that's a firm date that's set by legislature, it's supposed to take effect on July 1st. I think it will probably be ready by that date. Tara talked about GIS updates. We've added a mosquito layer now, which I think will help identify our needs, where we don't need to trap, where we do need to trap. So I think that's going well. And then we're also looking at some added technology for some GIS mapping of systems where Greg, our part-time environmentalist, we can actually map out an entire system, on-site system on the GIS layer. So if a resident comes in and wants to know where their septic system is, we could literally provide them a map showing the exact location of the system. This equipment that I'm looking at is relatively cheap for health departments. It's like $2,500, but it's good within centimeters of accuracy. So looking forward to that. I have 2 certificate of appointments that I need to get signed before for Dr. Gressel and Dr. Meyer before you leave when you go up to the auditor's office. So I have the notary up there. Permits so far this year, we've issued about 10. 3 of those were permanent holding tanks. Those are gaining popularity with the Amish. They're opting not to put in a full on-site system. They're going with just a holding tank. Those things are due to a House Enrolled Act bill that we certainly didn't like and support. But it's a viable option now in the state of Indiana that I can have just a tank. I have to agree to have a pumper, supply a contract with the health department. But one of the things I'm looking at is moving after July 1st. I can put those on a 2-year operating permit to where every 2 years they get an inspection. To where we know that they're not just discharging it to a ditch or any other means. So that's part of the conversation in the fee structure. I'd like to bump that operating permit up considerably because there is going to be considerably more work with those permanent holding tanks.
Are you gonna require pumping receipts?
Yes.
That they
that's
show
part of the
they,
bill.
they part?
So the bill includes providing a copy of a contract with a pumper to the county. Our goal is to, as part of the operating permit, is that needs to be renewed every year. So a current contract.
Mhm.
They have to have an alarm on it at 2/3 capacity. So it has to trigger an alarm at 2/3 when they need pumping on that. And they have to commit to providing receipts to the health department.
Is that battery operated alarm?
A battery operated alarm will work.
Okay, Joe,
Yes, sir.
sounds great. And Mark Wynn, our plant director, just came in, so I'm sure his ears are open. I'm hoping you can hear back there, Mark. Okay. I guess my question, looking ahead, perhaps after July at least, who's going to do the inspection? Plant commission or health
It'll
department?
be us.
And I was just listening to your staffing, the changes and the leaving.
Yeah.
It appears to me that we're gonna have to take a hard look at your staff here.
I've already took a hard look at my staff and probably will be asking for an increase of at least a half-time.
Okay,
part-time.
Shannon, is that something that he needs to communicate directly with you?
Yeah, we've been working a lot.
Oh,
together.
okay,
Yeah.
you're ahead of me, thank you. Okay,
That's the last of the updates I have. So if you wanna step up, we'll talk about the last.
Okay, one thing, Joe.
Yes, sir.
Mark, after what you just heard, do you have any comments about the new legislation?
Well, that happened last year and they've been doing it. It's obviously discouraged, but as long as they keep the receipts and have to prove it, that's the only, that's what they're gonna have to do. I do know that some, Joe probably knows this better than I do, but I knew there's some that started that direction because it saves, the money up front, whatever it might be, 15,000, 20,000 per system. And then once they realize how often they gotta pump it, because, it might be a 1,500 gallon tank, but you can't take it empty or it floats. So they're pumping often.
Yeah.
And the cost starts getting to be.
Well, and my fear is they won't always have it pumped legally.
Yeah.
That's my concern. Right now, a permanent holding tank only gets a one-time permit, no operating permit. The new state law that I referenced will have language in there that we can put a 2-year operating permit on these type of tanks. So that's where we're going, so.
Are we able to go back on the ones
I
that have,
don't- I don't
that
believe
have
that'll
put
be,
in since the law,
that'll be a
like,
discussion with Luke, but I don't think we can
Okay.
go backwards. and-
okay, so it would be.
But we
any
can
tank-
still inspect.
Yes,
We'll still be able to
yes.
pin them down on
You can't put
pumping.
an operating
I
permit
don't
on a
think I-
tank that was
no.
put in
I
before
don't think
July.
cause it wasn't in the state rules, so I don't think I can do it.
Well, you know, Mark could probably verify. If the inspections are in a consistent manner and done, they will probably abide. If we lapse,
Oh, yeah.
I know the rest of the story.
Give them an inch, I'll take a foot.
And Greg is very good at the inspection, so from what I've seen, so. You know, it's kind of our downtime right at the moment because not a lot of construction has started, but. Yeah, once we gear up into the season, Greg and I will probably in the field quite a bit until
Thank you.
I add some additional.
What happens if they can't produce the receipts, the pumping receipts?
My only other alternative is to contact the pumper directly to see if, you know, if they can provide me some receipts. The other would be then to just ultimately take action on them and possibly either cap that tank from being able to receive or order its removal out of the ground. Most of them are putting in plastic tanks. And it's marked and noted that once you pump those, if you pump them dry, they're gonna pop out of the ground.
That or,
They're gonna,
or the,
they're gonna look like a submarine that's surfacing.
Huh.
And I've seen many, I've seen concrete tanks do that. So our only probably alternatives, if they're not being compliant, would be to fully remove that and then require them to have a full on-site system, so.
Joe, look at your staff very closely.
I will, yeah. I've got a few ideas of mine that I'm working on.
before you get going on this, reconstructing of the department, I have a couple things. With July, 1st coming out with new ordinances. I feel either we need to, as a group, we won't have a meeting till August. That'll be our time frame, right, for the board meetings. We're
Meet every other month.
every other month. That's our
It'll be June and August.
June. You should have a meeting in June.
June and then in August. So I'm saying that either we get a group of a couple board members together and start going over soon as this ordinance comes out, because I don't want to drag our feet on once that comes in, and that, or just schedule another meeting in July. After this meeting, after we get the new ordinance, I think we ought to have a group to sit down and get a direction that we need to go with this. We've been talking about this ordinance. Jessica's talked about it for what, 2-3 years, that we weren't allowed to do anything. Now, July 1st, we'll be able to absorb some of this. I know you know a lot of it already and not allowed to say.
Yeah,
But-
an ordinance would still have to go before the technical review panel.
Mhm.
I believe that the goal of the new rule is to not have the need for a county ordinance. They've increased definitions. The rule itself is not drastically changing. There's very few in the field changes. if I
Okay,
could say. Most of its definitions allows us better guidance on reconnection and when we can require an inspection. Because under the current rule, I can't require an inspection. I can't require it, it's suggested. Under the new rule, I can require an inspection if there's a reconnection to an existing system. If I tear down a house, I want to rebuild my house, then I can ask I'll be able to require an inspection. So there's a few changes. I do plan on meeting with all the installers on this. I know there'll be training coming out from the state, regional training for not only local health departments, but also installers as well. So,
uh-huh.
but I think the technical stuff in the field, there's not many changes.
There isn't many changes.
No.
So,
Sizing is all still the same. Types are all still the same.
but requirements,
Requirements, yeah.
multiple dwellings on a property using one system.
The state's gonna be silent on that. That'll still be kind of up to local zoning and planning. I've got some, I should say it, I'm speaking from my old job, but I know some counties don't require multiple or allow multiple
Uh-huh.
homes, and some allow two. But
What do we allow, Mark?
two,
Two?
When does the comment period close and will we know most of this stuff by June, like as far
Yes.
as what the rule?
yeah, I believe
then
so.
So we'll know some in
Yeah,
June.
yeah, I think we should.
For
have
that
a better
meeting and then
Well,
be able
then
to-
we can deal with that after the
Yeah.
June meeting.
Yeah,
That's, maybe Joe and I will work on trying to put together some kind of just summary of what changes we're expecting.
What we can do.
Something
That would
we
be
can
great.
accommodate
Yeah.
to.
in
The
June.
cliff notes,
Yeah,
what we need to know.
yeah, so that we can.
You know,
be a month ahead of others.
I've been off the sewer district for going on 4 years now. And there's still many homes that aren't hooked up, not a lot, I don't know. There's probably a couple dozen that have not hooked up yet and, you know, will we have new guidelines from the state that we have to make them hook up?
well, the language, and I'm paraphrasing here, so if I get this wrong, the language says that the health department, local health department, may require a connection. It doesn't say shall. If you're familiar with state code, they use the word may and shall a lot. As
I
to
think we
whether-
had a president used to use that.
as to whether you can force them or whether you cannot force them, but there is a section now on connection if it's within 300 feet of the property line, but that's only if the current system is in documented failure. So if it's not shown any visible signs of failure, I don't know if I have the legal standpoint to say you have to connect. That's gonna be the one area that is gonna be,
That's gonna be tough for us.
yes, yeah, very tough for us. Cause as you probably know, I mean, we've got several permits out there that are for systems that were never really described in the rule, so. But as we find those, and as they wanna update those, we fix those. No more gray water systems in Adams County. We only do,
Those are done.
we've not, Jessica stopped permitting gray water systems a few years back. So
How about the gray water systems that are out there, 10 years or older?
we're allowing them to continue.
Do we have any jurisdiction on checking them?
I don't know, because the problem is they have a valid permit. They have a permit that was issued by the health department. It's pretty, no pun intended, it's a pretty gray area.
Mark, go ahead. Mark, what's the comment?
Well, I just had, since we're talking about that stuff,
Speak up, Mark.
there's a few areas out there that I know Joe knows some of them that I haven't really bombarded yet because I'm letting you get your feet wet. But
Thanks.
there are still some houses that are absolutely not hooked up, that are 3 and 4 year old permits. They moved in. Water's going out the whole of the basement wall and down the side of the basement. I can drive you to one.
Those we can address.
Those can be addressed now. We don't have to wait until
We
June.
could probably address those.
Okay. I'll Sunday.
What-
I mean,
I haven't made a lot of changes in the program. I mean, I've been
Yeah,
here,
you only been here a couple.
I've been here a month.
Yeah, let's not run him off.
No, one of the things I did though is that we no longer issue the permit until the fee is paid. Because we were getting plans in, issuing a permit number. And it might have been 6 months before they come in and finally paid for it. Or sometimes they never came in and paid for it. So trying to have an accurate number of permits that are out there. So I recall back a time when I was in Huntington County, my former, and I got my hands slapped by the State Board of Accounts because I was accepting fee payment before the fee was issued. It's like, or the permit was issued. It's like kind of the same thing here. We were issuing a permit before we were getting the money for it. So, especially when it crosses from one year to the next. So we've kind of stopped that, so. But it's a process, so.
Well, Joe, I can, as a commissioner, okay? thank you for applying and taking this position. Sincerely.
I was ready to come back to the local health department.
Well,
I
good.
was.
Thank you.
I was. And it was a great staff. And then, of course, unfortunately now 3/4 of them are not around, but I don't know if that's personal. I don't know. No. But hopefully moving forward, Shannon and I have been working on a plan to hopefully, and I didn't copy the proposed structure. Yeah, let me run a copy of that. My apologies for not having your packets. Tara and I are kind of working on the fly, and they got out in the mail, but apparently they just didn't get to you, so.
No longer deliver at the same time as you did before, maybe 3-4 days.
Yeah, it's okay. I'm just
Sorry.
gonna text it. I'm gonna be
Snap.
late, so.
That's the stamps going. So Shannon and I have been having a discussion about the framework within the department and where we're at, where we're going. By this org chart, we're not increasing the number of FTEs. We're working with the same amount. But previously, we had 2 office managers, one for the environmental side, one for the clinical side. The goal is to combine that under one, stop duplication of duties, things like that. So probably the biggest change you'll see in here, and we've met numerous times over the last couple of weeks with these, is the assistant director or a deputy director, whatever we end up calling it. They'll have the functional lead over the clinic. May not necessarily be an RN, but we do have 2 public health nurse positions. One's vacant right now, and Megan takes the other one. So by adding the second public health nurse, but not in an administrative role, that allows us to get that public health nurse out into the field with some mobile clinics, some education to targeted communities, things like that, and sharing the duties. Megan's got a lot on her plate right at the moment, especially since Holly left. She's doing a fine job, but she definitely needs some assistance there. The health services coordinator is kind of a revamped position. It's going to do the clinic scheduling. It's proposed to do the clinic scheduling, then also incorporate Sadie's role as the school health liaison, and then the community outreach. So kind of blending those 2 positions into one. And then the environmental positions are not changing. The vital records are not changing. The office manager is changing slightly to do processes for both sides, and then also handle as backup for both sides. So that's the proposed org structure we're looking at right now.
Can I ask, are all of the positions that you have listed here, are they already budgeted and funded?
Yes.
Yes.
They're budgeted through various grants, which one of our goals upcoming is going to be to figure out how to get those paid for out of non-grant funds necessarily, so they aren't in limbo if the grant goes away. But we took one position and kind of split it out amongst other positions, and then we added the additional labor in the nursing role. But yes, they're all currently budgeted for and funded. Like Joe mentioned, we have 8 full-time staff, and we're not increasing or decreasing that necessarily. We're staying at 8 full-time staff. We're just changing the duties and the titles of how that labor gets allocated.
Okay, it would help me if, once you get back to TO and staff, if you could attach a name to those positions. So just so I have trouble with my kids' names, let alone.
Certainly, that'd be easy. Yeah, that'd be.
What percentage of the budget right now is funded by grants? Any idea?
Megan's position is fully HFI funded, I
It's a
believe.
loaded question, but
Yeah,
yes.
yeah.
Yeah.
And that's my fear is that
I hate,
HFI, you know, we're at the whim of the
Mhm.
state.
I hate depending on grants.
Right.
And
Kinda
I'm
like the wind.
terrified,
You know
I'm
which way they're
terrified with
blowing.
having staff members fully on grants, because
Yeah,
if the funding goes away, then
Yeah.
suddenly it's an
I've seen
emergency.
it, I've seen it. I've always, when I was in the education field, I said to administrators, be careful with grants, you might get it. There's a lot, Mark.
They can do some
Now,
great work.
here's my
Grants do
suggestion.
great work,
Here's my, I know,
but not for staffing.
exactly. Now, what you need to do is when you submit your budget to the county council for next year, include the total amount and then put in parentheses, grant. Okay, that way you're not gonna catch the county council cold turkey if the grant's not renewed.
Right. Yeah.
Okay,
Yes.
because if you don't do it that way, that gives certain people an excellent opportunity to say, can't do it. Okay?
Right.
Thank you.
No,
Yeah.
it's been on my mind since I found out I had grant funded employees, so.
I'm told that's why pushers make the first few hits of heroin free. You get dependent on it, and then pretty soon, now you're providing the service or using additional funds out of the county. So they kind of entice you with that, and then it dries up and goes away.
Now, I think
You have a question back there,
Ma-
Joe?
I'm not the only fully grant funded staff member. Sadie is our second.
Sadie is, she's not fully, is she,
She's full.
is she fully as well? So I got two. I got two staff members. But that's the direction we're wanting to go.
Sounds great.
We've, Dr. Ainsworth have selected this, Katrina.
Yeah,
within
that
our-
That was a big discussion when we looked at this and did some work behind the scenes, was trying to
That's great.
eliminate and, yeah, restructure those so
We-
that
we-
they're not,
we-
because these people are doing great work and we've got a
we-
lot to do yet and we don't wanna lose those and
We've
take
met
another
with the
step back.
staff. I think we have buy-in from the staff. I mean, I haven't heard otherwise, so. But, staff it seems to be okay and on board with this. So,
And that, just another hint. I've dealt with this before. Document if you have to defend the position.
So next steps in my mind is that, assuming that this board approves this restructure, then, and the job descriptions that are attached to it, then we would take this to the commissioners as well and get their approval and their buy-in. And then there's only one position in my mind that would have to go in front of wage and council for a consideration on salary adjustment, but otherwise all of the other positions would stay the same. And then Joe would work with me, the auditor's office, whomever is appropriate, to figure out the budget portion for 2027 to try to get, the positions in 1159 versus in those grant funds. So we are gonna cover all our bases. It's not that we're just gonna, go with you guys, and if y'all say it's okay, then we're gonna rock and roll. We're gonna reach out to the other bodies as well.
So just to make sure we don't get caught up in a chain of command thing. Does the board have to approve first, then it comes to commissioners?
I think so
yes.
too, but
Yeah.
I
Okay,
think so. So our plan is that if this had passed today with you guys, then I was gonna send you three an email and say, hey, here's what went down, here's the structure, here's why, et cetera. Give you guys a week-ish to look over it and then bring it to you next week on Tuesday.
then put it on the agenda.
Yes.
And you and Joe would present.
Sure.
Sounds like a plan.
Do you have any questions or anything?
Any board members have questions? I've kind of hashed through it, so the opportunity if anyone else has any other questions to feel free to ask.
Will the assistant director be a nurse? More
Um,
likely.
it's not required to be a nurse, the way we have it currently.
Mhm.
They would oversee the clinical staff.
Okay, don't have to have the RN status,
No,
but
we'd
yet,
have the two RNs that would meet their.
that would lighten up the nurses' load where they can do more of the,
Yeah. It would give us two
Nursing
nurses.
yeah,
It would give us two RNs.
that would be better, right?
working. Yeah.
Huh. I like it as a board member, the big thing is gonna be falling back on Dennis's crew, you know, to get rid of the dependency on grants.
Right, right.
you
And it
know.
would just be, a process of shifting some of
Yeah.
the, financials out of 1159, which is county general, into the grant funds.
And we can still use grant funds and maybe not necessarily use all of council's money or appropriations for it.
Right. So instead of having like all of the money where you buy your stuff for your programs in county general, we would shift that, in my mind at least, to the grants and then
Yeah.
put the salaries themselves into county general, so they're kind of protected. Which, I mean, we all know doesn't mean that any position isn't, can't go away at any point, right? But there's a little bit more protection when it's not solely grant funded.
My daughter does grants for Allen County and a lot of them, not a lot, but some are going away. She says they're not able to get, and some of them have just disappeared as far as funding for the grants. So we got to prepare in case that happens.
All right. Anyone else? Any comments?
I like it.
Okay, can I get a motion for the? In a second?
Second.
All those in favor?
I,
Anyone opposed? All right,
Thank you.
motion passed. Does anyone have anything else? We are due to wrap up here. All right, motion to adjourn meeting. All right, thank you.
we got a lot to do.